y'all, Dixie here. Today I want to talk to you about first aid and foot care while backpacking. In a perfect world, we could just sashay down the trail without worry or concern about being injured. Oh God, but that's not really realistic, and in any physical activity, including backpacking, minor injuries are common, including blisters and other foot issues. So I'm going to go over some of those common injuries today and cover how you might could treat them on trail. Just a disclaimer, I am not a medical professional, so this is not medical advice. Because foot issues are pretty common on trail, if you just make a point to properly take care of your feet, it can help prevent a lot of those problems. The first thing that you can do is make sure that you have properly sized footwear. A lot of people wear a half a size or even a whole size bigger while backpacking than they do in normal life. While you're backpacking, because you're putting your feet through a lot of physical activity that they might not be used to otherwise, your feet can swell. I'm not saying that if you go out and you get a hiking shoe that's a half a size or a whole size bigger than your normal size shoe that it'll definitely work perfectly for you, but there are a couple of rules of thumb for when you're trying on a pair of shoes that you want to wear on trail. First, you want to make sure that you have a thumb width length between the tip of your toe and the tip of your shoe. Next, you want to make sure that when you've got the shoe laced up like you would hike in it, that if you tap your toe on the ground, that your toe does not hit the front of your shoe. The reason that you want to check for having enough room between your toe and the tip of the shoe is when you're walking downhill, if your toes are sliding to the front of your shoe and hitting the front of it, then your toenails will likely turn black and can fall off. And that's not a comfortable thing. Your feet can get bruised, you'll get blisters potentially under your toenails, and these are all things that I've had happen to me personally and I've seen happen to other people. So again, you want to make sure that your footwear is going to fit properly. Before you go backpacking, you want to make sure your toenails aren't too long, so that even if your feet do approach the front of your shoe, that your toenails are hitting the front of the shoe, but also you don't want to trim them back so short that it causes you issues like ingrown toenails. Also, you need to make sure that your feet are protected but not overburdened. So you'll have to figure out whether trail runners are going to work best for you or a more solid, more sturdy hiking boot. And if you want to learn more about this and kind of help determine what would be best for you, you can check out the video that I did on backpacking footwear, and I'll put a link to that video in the video description of this video. Other than properly fitting footwear, there are other ways to take care of your feet. For example, when you take a break during the day, go ahead and take your shoes off. You can even pull your insoles out and take your socks off to allow your feet to dry out real well, and your footwear. It may not seem like it's completely soaked, but there is going to be sweat in your socks and your shoes, and allowing your feet to air out will help prevent things like trench foot or other bacterial or fungal issues. You can soak your feet in cool creeks, or at least when you get to camp in the evening, make sure to rinse your feet off. That'll help clean some of the salt and just funk off of your feet and help your feet feel better, but also to be cleaner and to prevent issues like blisters that can happen with sweaty, damp, funky feet. I normally only take 2 pairs of socks to hike in, and then I have 1 designated pair for sleeping when it's cooler out. But the 2 pair that I take, even if I'm on a 5+ day backpacking trip, I just rotate those out. So I'll wear a pair of socks for a day or 2, then rinse them out with some water, hang them on my pack to dry, and then I wear the second pair. And I just keep rotating them out like that, because even though it's not as clean as if I was doing laundry, it's a little bit better than it was, and again, helps me protect from getting blisters. If you know you're prone to blisters, you can try sock liners. They kind of help with the friction between your sock and your foot. And if you tend to get blisters between your toes, then Injinji sock liners might work well for you, or Injinji socks in general. And they're just kind of like gloves, but for your feet. If you feel like sand and or debris tends to get in your shoes a lot, then you can wear gaiters, and that'll kind of help prevent some of the friction of either sand or little twigs in your shoes. If all of the methods of preventing blisters from forming do not work and you start to feel a hot spot, you should take your shoes off and do something about it immediately. I know a lot of folks who will feel a hot spot kind of coming on, and they'll think, well, I'll just handle it when I get to camp later. But the best thing that you can do for your feet is to stop immediately and check the area and see if you are in fact having some kind of friction issue. And then you can do something like apply Leuko tape or Moleskin to help keep the friction off of your skin. Then you'll want to make sure to keep the area as clean as possible. If you do develop a blister, I had a nurse recommend to me to at least wait 24 hours before popping it. Some people pop them, some people don't. I've seen blisters where they probably should have been popped because when they weren't, they continued to grow and ended up developing into a huge blister. So it really just depends on your feet, the blister, how you feel about it, and you just have to make that call in the field. If you're gonna pop it, make sure you clean the area very well. Again, probably best to wait 24 hours to allow some skin to develop under the blister. And then you want to make sure your needle is as clean as possible. I generally burn mine with a lighter and then put some hand sanitizer on it. Then insert the needle into the blister and allow it to drain. Some people will take a needle and thread and rub triple antibiotic ointment on the thread, or Neosporin, and then take the needle and put it through the blister and allow the thread to hang out of the blister on either side. Thread allows the moisture to wick out while they're sleeping. It also is putting triple antibiotic ointment inside the blister, which I feel like can't be a horrible idea. And the thread also keeps the holes open on the blister, that way it can continue to drain. Another issue that backpackers are sometimes plagued with is plantar fasciitis. I dealt with this on my thru hike of the Appalachian Trail, and it's extremely painful. Plantar fasciitis is the inflammation or irritation of the band that runs through the bottom of your foot. So if you pull your toes back and feel what feels like a tendon there, that is your plantar fascia. This might not be quite as problematic for somebody that's going out on a shorter backpacking trip, like a weekend trip or even a week long, because you can work on dealing with this issue before you get out there and also after. But if you're going on a more extended trip, then it can cause you some problems. One of the best things that you can do to help prevent the issue and or treat it on trail is to stretch your calves. Your calves are connected to the Achilles tendon, which is also connected to the plantar fascia. You can also take a tennis ball along and roll your foot on it. I felt that either that or a bouncy ball was really nice just to have that pressure and massage the plantar fascia. I personally have had luck with the Dr. Scholl's inserts for plantar fasciitis. I find if I use those insoles and I make a point to replace my trail runners at least every 500 miles, if not a little sooner, then it pretty much keeps the plantar fasciitis at bay. I've heard that transitioning to the zero drop shoe like the Ultra has helped people with plantar fasciitis. Those types of shoes can take a break-in period, but I have heard of people who had issues with their plantar fasciitis and other issues with their feet, and those types of shoes helped a lot. One common issue while backpacking that is horribly painful to have is chafing. When you take skin that is warm and damp and dirty and you're just constantly having friction on it all day, chances are you're gonna at some point end up with chafing. The best thing that you can do for chafing is, of course, just take a break, take time off. But if you're out on a set backpacking trip, then you're not going to want to stop just because you have some chafing going on. So some things that you can do to help out with that is to make sure to keep the area as clean as possible. If it's warm enough out and you can sleep with no bottoms on and allow everything to air out down there, that's great. If not, at least try to sleep without underwear on. Maybe powder up the area to help dry it out. Ladies, you want to make sure that you use a cornstarch based powder, not a talc powder. While you're hiking, you can use a product to help reduce the friction on the area. Things again like baby powder, Gold Bond, or even Body Glide. You can also experiment with different clothing, so the seams may be causing you issues. Some people find if they don't wear underwear it helps, or if they do and they weren't before, that helps. And everybody's body is different, so you're really just gonna have to experiment and figure out what works best for you. Next is the twisting, swelling, or spraining of joints. The first thing that you can do to prevent issues like this is to be mindful of your surroundings. When you're walking, it's a good idea to pay attention to where you're going and to look down and make sure you're not stumbling over a slippery root or a rock. But at the same time, I find myself wanting to look up and enjoy the scenery that I came to see. So I understand that the struggle is real. If you do find yourself injured in some way where you've twisted a joint, it's now swollen, or you've even gone as far as to sprain it, then you want to soak the joint or painful area in either a cold spring or whatever cool water source you can find. Take ibuprofen or other anti-inflammatory, and if you can, elevate the area that is painful. If you feel like the injury is bad enough where you want to go ahead and get out of the wilderness and seek professional help for your injury, Then you can wrap it with a couple of bandanas and some sticks as a makeshift splint. Use your trekking poles as crutches the best you can, and go ahead and head back to your vehicle or whatever access point you came in. If the injury is bad enough to where you feel like you cannot get yourself out of the woods and there's nobody there to help you, then that's a good instance of when a personal locator beacon or a spot device, so a one-way communication device, or the InReach, which is two-way communication, would be a great idea, because then that way you can call for help. Next up are cuts and scrapes. I'm not sure that I could get through a backpacking trip without some sort of cuts and scrapes. And the best thing to do when this happens is just to clean the area as well as you can. I use hand sanitizer, filtered water. If I have some antiseptic wipes, those are a great idea to have, or even baby wipes, because I'm basically always carrying those. It's a good idea to carry those little individual travel packets of antibiotic ointment. That way you can apply it to help prevent infection. I have found that Band-Aids don't really work, especially if I'm applying them to my feet, because they just come off within minutes after I start hiking again. Gauze pads and medical tape of some sort works a lot better. And if the cut is bad enough and seems to keep bleeding, then make sure to apply pressure. You can take a bandana and fold it up and mash it down hard on it, or even tie it off with another piece of clothing. Finally, it's never a bad idea to have super glue if you need to close a cut. I know that that's not maybe the best or safest options. If you're willing to pay a little bit more and you want a better product for this use, then you can get what is called Marathon Skin Protectant. This was recommended to me by a nurse who said that you can use it for blisters, burn areas, areas that have been rubbed or scraped, even puncture wounds. Next is poison oak, poison ivy, or other poisonous plants. The best thing that you can do to prevent coming into contact with one of these plants is to learn to identify them before you go out backpacking. And if you can, have somebody with you who does know these plants and can help you learn to identify them. If you do end up developing a rash and you think you've come into contact with poison oak or poison ivy, the best thing to do is to not scratch the area. I'm sure that it would itch and be uncomfortable, but by scratching it, you can end up spreading it, and also you can end up scratching open your skin and having the potential for getting an infection. If you're extremely allergic to these plants, then you definitely want to take some extra precautions. One of the fellas I met on my thru hike of the AT wore knee-high socks because of that issue. Most people who have a reaction to poisonous plants aren't extremely allergic to them, so chances are you can wait for further treatment once you get to town. Let's talk about hypothermia. Most people probably think that if they're backpacking in the 3 warmer seasons, so spring, summer, and fall, that they won't have any issues with hypothermia. But you can actually experience hypothermia even in warmer conditions. Hypothermia happens when your body can't maintain a normal temperature. It's important to learn the signs and symptoms of somebody that has hypothermia, so you can hopefully maybe recognize it in yourself, but also you might recognize it in people that you're hiking around, and then you can help them. Some of the common symptoms are shivering, disorientation, or confusion. At that point, a shelter should be set up. Whoever is suffering from conditions of hypothermia should be warmed up as quickly as possible with a sleeping bag, an emergency blanket, by hugging somebody else and having body contact with a person who is able to maintain a warm temperature, or whatever you have to do to warm that person up. If you can, get the person something warm to drink or some calories, because it takes calories to keep your body warm. And I know a lot of times I've found myself in cooler temperatures not wanting to stop and take a break because I'm cold, so I don't eat as much as I should, and it ends up having the reverse effect because my body's working so hard to warm up, but I just haven't provided it with sufficient calories to do so. And finally, if possible, the person who is experiencing hypothermia should be evacuated. Snake bites. Chances are you're not going to be bitten by a venomous snake while you're backpacking. But when I started my thru hike of the Pacific Crest Trail, I was pretty worried about being bitten by a rattlesnake. So I tried to find comfort in the fact that 7,000 to 8,000 people per year in the US are bitten by venomous snakes, but usually only about 5 die from that snake bite. And as long as you seek medical attention as soon as possible, you're usually going to be okay. The best way to prevent being bitten by a snake is to be aware of your surroundings. When you sit down to take a break, you want to make sure that you're not sitting on a snake who's curled up next to a rock, or lean against a tree where a snake is hiding. I've seen little bitty rattlesnakes curled up in a V of a tree, so just be aware when you're sitting down or setting up your tent or going to the bathroom that you're on the lookout for snakes. You can take a trekking pole with you when you're going off trail and kind of tap around. I also do that when I'm crossing a downed tree on trail if I can't see on the other side of the log. And then of course, do a general scan of the trail while you're walking. I've been in La La Land before and walked up on some snakes pretty quickly, but most of the time I see them before I get within striking range. If you are bitten by a venomous snake, they say to stay calm. And I know that sounds almost impossible, but to the best of your ability, stay as calm as you can, because if you don't stay calm and you start running around and freaking out, you're just going to increase your heart rate, and that's going to spread the venom around your body quicker. Keep the bite area at heart level or below, again, to decrease the spreading of the venom. And before you clean the bite, you want to allow it to bleed freely for 15 to 30 seconds. And then seek medical help as soon as possible. Again, this is an instance where a personal locator beacon or some sort of device that you can call for help would be very useful. If somebody that you're with has been bitten, it's recommended that you tell them to leave their pack or at least drop as much weight as possible, and then help them slowly and calmly to exit the wilderness. You just want to have them exerting themselves as little as possible. Or the same for you, if you're alone and can't call for help, then you just kind of course, want to get there as soon as you can, but try not to overexert yourself and to stay calm as possible until you get out of the woods. It is recommended that you do not apply a tourniquet to the area, because then you're concentrating the venom in one area, which is bad for the tissue. And while tourniquets have their uses, it's bad for keeping a limb in general. Because of the same reasons, it's not suggested that you apply a cold pack, because it can reduce the blood flow and again concentrate that venom to one area. And finally, you don't want to cut open the bite or suck the bite, because that's for the movies. Those are the most common ailments that I have either experienced or seen other people experience while backpacking. But now I want to go ahead and run down a list of things that you can include in your first aid kit. They're a good idea. Of course, this is just a baseline because everybody's individual needs are going to change this a little bit, but this is just a good place to start. Some good medications to have on hand while backpacking include Neosporin or other triple antibiotic ointment, Benadryl or other antihistamines, Ibuprofen for swelling, fever reducer, and pain. And finally, something that I will never be without on trail is Imodium or some other anti-diarrheal and Tums, because I think that having diarrhea on trail is one of the worst experiences I've ever had in my life. It can also be dangerous because with diarrhea, you can quickly become dehydrated. So if I could only have one of the medications on that list, it would be an anti-diarrheal. Other items you might want to bring are things to treat blisters like Moleskin or Leuko tape, or whatever you prefer to treat blisters. Gauze bandages, butterfly strips, super glue, or that marathon skin protectant I mentioned earlier. Antiseptic towelettes or baby wipes, hand sanitizer, tweezers, a knife or multi-tool. You never know when you might want to cut bandages or cloth, a needle or safety pin, a bandana, and in the colder months, I recommend having one of those emergency safety blankets. They're really cheap, pretty lightweight, and it can save your life. Also, they can double as a ground cloth for cowboy camping. Again, all of that is just a good starting point, and you can tweak it to add or remove things as you see fit. But keep in mind that you're never gonna have every single thing to cover anything that could possibly go wrong while on trail, but it's a good idea to have things to cover the most common basic injuries. For anything more extreme, I know I've mentioned several times in this video, but it's always a great idea to have a personal locator beacon. That way you can call for help in a true emergency. I would love to see what all of you carry in your first aid kits in the comments today. If you don't mind sharing that, I think it would be a good idea for folks who are just getting into backpacking to see some ideas of what to bring that maybe they haven't thought about. Or maybe somebody will realize, hey, I might be being a little too excessive with my first aid kit by carrying a stethoscope or a blood pressure cuff if that's not something that I need in everyday life. Thank y'all so much for watching, and if you found this video useful, don't forget to subscribe before you go, and we will see y'all next time.